You've just been diagnosed with a basal cell carcinoma, or BCC, the most common type of skin cancer, not just in Australia, but worldwide. In fact, BCCs make up about 70 to 80% of all non-melanoma skin cancers treated in Australia, so you're definitely not alone. This is something we see and manage regularly. This is not melanoma. It's important to understand that a BCC is not melanoma. BCC is a different type of skin cancer. It usually grows slowly, stays localized to the skin, and almost never spreads to other parts of the body. That's why it's often described as the least dangerous skin cancer, but it still requires proper treatment. So what's the outlook? The good news is that BCC is highly treatable and curable, especially when it's removed with clear margins. Once it's gone, it rarely comes back in the same spot. That said, some BCC subtypes can behave more aggressively, so we continue to monitor the area as a precaution. What causes this? The most common cause is cumulative UV exposure over your lifetime from everyday sun exposure, especially in your earlier years. Genetics can also play a role in increasing your risk. Can this turn into melanoma? No. BCC and melanomas are completely separate types of skin cancer. One does not turn into the other. You may have some other questions. How long has it been there? It's hard to say. BCCs grow slowly and may have been present for months or even years. Why didn't I notice it earlier? They often don't hurt and can look like harmless skin spots or scabs, which makes them easy to overlook. Can I still go out in the sun? Yes, you can, but with greater care. Use SPF 50 sunscreen daily and protect yourself with shade, hats, sunglasses, and clothing. Will it come back? No, not usually in the same spot if it's completely removed. However, once you've had one BCC, your risk of developing new ones elsewhere increases. So annual skin checks are recommended. What should I look out for in the future? Watch out for new spots that don't heal, change in shape or color, or bleed easily. Early detection makes all the difference. In summary, while being diagnosed with any skin cancer can feel worrying, a BCC is the most common and least dangerous form, and it's usually curable with straightforward treatment. You are now in a better position to take charge of your skin health with regular skin checkups and sun protection as your best tools for prevention. Monitor your skin and reduce the risk of future issues and if anything new pops up. And if you like some examples of how BCCs can look in real life, I've included a few trusted links in the video description. These show different ways BCCs can appear, and they've all been carefully vetted. On this channel, you'll find other videos, short videos, simple and clear explanation on sunscreen, sun protection, and other skin cancers or skin health. Here are some of the links to a couple of them. Thanks for watching. I'll see you next time.